The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy, a local Health Mart pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank Mercy Medical Center, Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. In the studio with me is Brad White, a compounding pharmacist, and our very special guest, Joel Porquez. Is that correct, Joel?
Yes, that's correct.
Okay. Clinical Manager of Mercy Sleep Disorders Center. Good morning, Joel, and welcome to the show.
Good morning. Thanks for having me.
According to the U.S. Centers for Disease Control and Prevention, a third of adults report they usually get less than the recommended amount of sleep every night. Why does this matter? Not getting enough sleep is linked with many chronic diseases and conditions, such as type 2 diabetes, heart disease, obesity, and depression, all of which threaten our nation's health. However, the diagnosis of sleep disorders can lead to treatment. Today we're going to talk about sleep apnea, starting school later, and more. We'd like to remind our listeners today that our program is available on our podcast, which can be downloaded from the App Store on your mobile phone. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. If you have questions you'd like addressed today, you can post them up on our live Facebook feed, or you can give us a call here at the radio station at 330-450-1480.
You probably have the answer to this question. Why do we need sleep?
Very good question. Well, there's several theories out there, but I think in terms of looking at it as a child growing up, obviously an infant child will need more sleep because they're developing. So for development reasons, when it comes in terms of adults, for us, it's several factors. One is we restore and we heal our bodies during sleep, which is why one of the complaints that we see in the sleep lab is that if they're not sleeping well, they have chronic pain, they wake up a lot, toss and turn. That aspect. But I think the most thing is for growth, development, and what the latest stuff that we're seeing out there is the more you sleep, our memories are consolidated in sleep. So it helps the connections form when we get enough sleep. So when you sleep better, you tend to retain things better.
Interesting. So, okay, what drives sleep cycles?
So usually when it comes to sleep, in my travels and speaking with some of the sleep gurus, they always refer to your sleep debt. So obviously, if you've been awake for a very long time, that debt, and if you think of it as an analogy of a glass being full and constantly being depleted, the longer I stay awake or the person stays awake, your debt becomes greater. So that drive to sleep is one aspect because you're sleep deprived. The other one is light. This is why we have seasonal affective disorders. Unfortunately, when we have the shorter days, longer nights, it's dark at 4:30, 5 in the afternoon, we are already automatically sleepy, or depression may hit, especially out west or in Alaska where it's a little bit longer. But light. So if I look up to the light here in the station and light hits the back of my retinas, it inhibits melatonin. And so that starts that keeps me awake. And that's why there's a lot of things about light therapy as well.
So these people that live in like the Arctic Circle and stuff like that, I mean, they get 3 and 4 hours of daylight a day, sometime of the year, I don't remember when that is exactly, but what about these people?
That's tough. I mean, that's because we really need light to help keep us alert. And you'll notice, and that's what drives our cycles. So there was a study years ago, and it was studying, if any medical people listening, there's the Zeitgeber's study where they put patients in a cave. And if they put them in a cave and you see old pictures of of sleep studies being run on cinder blocks because in the caves there was running water underneath the patients going through, they actually realized that our bodies were set on a greater than 24-hour clock. So there's no light stimulation. So this just proved the fact of how much we need light. So that's why I think it's advantageous. Some people want that are shift workers, for example. They have light therapy or light therapy or brighter lights, greater lumens, if you will, wherever in their workplace.
I understand that one of the major manufacturers in this area years ago used to have 3 shifts, and they may still have 3 shifts, but you would work one week days, next week afternoons, and next week middays. I mean, that's got to be impossible.
Oh yes, they're called swing shifts, and those are very difficult. And I think we're able to adjust to those swing shifts at a younger age. But as we get older, it is more difficult. Just like jet lag tends to be a little bit more difficult to overcome when we travel as we get older. But those swing shifts is because there's no consistent bedtime.
Yeah.
And if we don't have that consistency, then your body doesn't know what's going on.
So our melatonin's up and down. Is that right?
Well, yes. And then and I'm not a physician, but this is why if you get sleep evaluated, the physician will go into more detail of why this happens. And there's also a body temperature component as well, because sleep onset occurs when our body temperatures are really low. That's why most people will complain that the sleep lab is so cold.
Can you explain melatonin?
It's from what I know, and again, this is probably a better question for the physician.
But there's a lot of people who just don't know what it's about.
Right. So first of all, it's over the counter. It is, to my understanding, it is released to help facilitate sleep onset. It is not uncommon for children or adults that have difficult time sleeping to take some form of over-the-counter melatonin. In my experience, I always take it to the next question of what's the quality of the melatonin, like what's the source? I mean, because obviously I don't think it's regulated by the FDA.
No.
But so there could be, I think the different brands make a difference of the type of quality your melatonin might be taking. So basically what it is that if it's dark in here, then the back of my retina is light, not enough light's going through my eyes, I am getting sleepy, I start yawning, and then the melatonin release starts to come on, and then it's a precursor for other hormones in our that are released that help us facilitate sleep. And then we go to sleep, if the conditions are right.
So if we're sitting in a dark room watching television, it's not enough light.
Right.
You should have light on around you.
Yes.
Okay.
All right, so how much sleep do we really need?
So the American Academy of Sleep Medicine, and they're the one that uphold the standards of sleep. And they, in 2017, because I get asked this question a lot. So in 2017, there were 15 sleep professionals invited from all over the United States. They got together and research-based. So they focused only on the bottom number. They didn't focus on the top number of how much is too much sleep. But they said, and the key word here, what I'm about to say, is optimal. So they said for optimal health, the average adult should sleep 7 or more hours a night. Okay, so obviously there's people out there listening, and they say, well, my gosh, I can sleep all 4 hours or 5 hours. You know, you're considered a short sleeper if you sleep less than 6 hours a night. So obviously for optimal health, we should prioritize sleep and at least sleep 7 hours or more.
Well, there are some pretty famous people out there that 4 hours sleep, and one of them is the president. I mean, sleep 4 hours a night, texting or tweeting people all night long. I mean,
well, he has executive time when that comes, right?
Come on. Yeah. Amazing.
All right, so is that the same for child to adult, or are we speaking collectively for adult population for 7 hours?
Well, this is from the studies were conducted, and consensus paper came out for ages 18 to 60 years of age. And these pretty much the AASM, the American Academy of Sleep Medicine, pretty much parallels with the National Sleep Foundation. So very close numbers. But when it comes to ages, now they did another one with children. So when it comes down to 4 to 12 months, and this includes naps, infants should be sleeping at least 12 to 16 hours a night or a day. That includes naps. When it comes to 1 to 2 year olds, they should at least be sleeping 11 to 14 hours a day. 3 to 5 years old, 10 to 13 hours. And 6 to 12, 9 to 12 hours a day. And this is the one that gets me, because so your teenagers, ages 13 to 18 years of age, should be sleeping anywhere from 8 to 10 hours a day. So that's why our last topic of the morning will be on the later school starts, that whole movement. Because what teenager do you know can actually sleep 8 to 10 hours a night?
Well, they're up there with they're covered up with their covers on their phone.
Oh, of course, yeah. Right.
I'll tell you what, we have to take a break here. You're listening to Health Matters at the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. A locally owned Health Mart pharmacy, whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking about sleep issues with Joel Porquez, clinical manager at Mercy Sleep Disorder Center. Have a question, post it on our live Facebook feed or call us at 330-450-1480.
All right, so before the break you told us that it's generally well received that we adults should get about 7 hours of sleep a night optimally. And so now I'm thinking about some of the problems we have. What about snoring?
Well, snoring, since we're talking about sleep apnea, or we will be talking about sleep apnea, I want to make it clear that just because someone or your loved one or a friend might snore does not necessarily mean you have sleep apnea. I think snoring for the pediatric age group, the American Academy of Pediatrics came out with any child with restless sleep and snoring should be properly evaluated. Their sleep should be evaluated by their physician. For us, snoring, the questions that the sleep physician will ask you will be how do you feel the next morning? Some of the things like, okay, I snore, but has anyone told you that you stop breathing in your sleep? Has someone seen you have these quick stop and start breathing, which is sleep apnea? Has someone actually witnessed you gasping? And a lot of this, believe it or not, happens whenever we go on vacation, when we're all forced to share a small hotel room. So snoring per se, I think one would have to ask themselves, okay, why am I feeling this? How are you feeling the next morning if you've been told that you snore? And then if you have headaches, dry mouth, I just slept 10 hours last night and I still feel tired. I mean, these are signs that something might be contributing along with your snoring, that you're not getting good night's sleep.
What about, you've kind of touched on it, as you age, you maybe need a little less sleep from the pediatric kids you mentioned. What about our patterns of sleep as we age? Do they change?
They do. And obviously, the golden question when I asked, and Dr. Dement is one of the big gurus of sleep down in Stanford, and when asked the same question, he said, well, it's well documented that our sleep becomes more fragmented as we get older. And one of the major causes of that are the medications that we take. So, yes, so when we go to bed, we wake up, but then someone's going to ask, the next question is, so do we need to sleep less in our 60s, 70s, 80s? Well, the question that Dr. Dement, the answer that he said was, our sleep time actually remains the same, but as we get older, we take more naps. Okay? So grandma, grandpa might be taking naps, or even our parents might be taking naps at lunchtime, or if they're retired, whenever they want to, right? So that leads a whole question about years ago about the debate on are naps good or are naps bad. So I think to quickly answer that regarding naps, they say not more than 30, 45 minutes. Because if you nap longer than 30, 45 minutes, there's a chance that you go into that deeper stage of sleep, that if you wake up, you actually feel worse than you did prior to falling.
So we don't want to go there to nap, to the deeper...
You don't want to go there. So in other words, you don't want to sleep longer than 45 minutes, because then you have the likelihood of going into a deeper stage of sleep, and therefore you wake up feeling even worse. But I think the recommendation that I just read was, if they say, because there's a question in the debate, are naps good or bad? So the answer they would say is, if I need to be alert this afternoon, then a short nap might be beneficial to you.
10 minutes, 20 minutes.
Your so-called power nap. As long as you're not over 30, 45 minutes. Everyone's different, right?
I see that as I never used to be able to fall asleep in a chair. Never. Okay.
Right.
And now as I get older, I can fall asleep in a chair. Okay. Now part of that's probably because I'm watching television, and what's on television doesn't exist very much anymore to really keep your attention. But okay, but I get up and still go to bed and go to sleep.
Well, something's to be said about that, because now the way in our health fairs and physicians, there's something called a questionnaire called the Epworth Sleepiness Scale. And what it is what is your chances on a scale of 1 to 3? What are your chances, your likelihood of falling asleep sitting, watching TV, sitting still watching a movie, or so forth. So, and then we add those numbers up, and then the greater the number, obviously, you have a sleep issue. It's such a good tool that physicians use and sleep labs use, is because even Medicare pays attention to the number 10 or greater. So there is something to be said about you sleeping, or a patient sleeping in a recliner, because sometimes in the sleep lab we say, I can't sleep in the bed, I sleep in a recliner at home.
Yeah.
Because sleep apnea can be more severe when someone sleeps on their back. So when someone tells us in the lab that they can't sleep they have to sleep on a recliner, then there might be a reason why, due to anatomical reasons, or they might be having sleep apnea. So if they sleep on their back with the bed perfectly flat, then they can't sleep because you can have those sleep onset events, and it wakes you up. See?
I knew this guy a long time ago, and he couldn't sleep. Okay, chair guy. Okay, recliner chair guy. Okay, and the maximum time he could sleep would be 20 minutes. Okay, so he had a TV in the room, a big screen TV, and he was a wood carver. Okay, so when I first went in his house, there was wood carvings all over either side of the chair. Okay, and in the course of I don't know how many years, he carved 300 or 400 canes, wooden canes. But he would sleep for 20 minutes, wake up, be awake for a couple of hours, sleep for 20 more minutes, wake up, and this was his pattern. He lived alone, of course. And
Right. So that's obviously that's self-reported, or reported by someone. That's why sleep diaries is also a tool that physicians will use. Okay, you tell me you don't sleep well, then the physician will say, okay, I'd like you to log what time you go to bed, what do you do, what time do you wake up, for at least a week or two, depending on the physician, and so that they will get a better idea of your patterns of sleep.
I guess I think of guys like that as that are awake for short periods of time, that they would be drowsy and unable to accomplish anything. Is it true? Or?
Well, lack of sleep, we're kind of opposite from children, but for adults, we're irritable, moody. Okay, we don't get that 9 hours, or we're sleep deprived. Just imagine how we function, groggy, and that's why depression. That's why it puts a tremendous stress on our heart, which is why they say sleep apnea or lack of sleep can cause higher blood pressure.
The thing is about this guy, he was good. I mean, his carvings were good. I mean, they weren't crap.
Oh, I bet.
I mean, he actually carved an Indian, out of a piece of wood, and I looked at that thing and thought, oh my gosh, that's beautiful.
So those that, if it's true, really true, that they sleep short bursts like that, then because our body needs REM sleep. So REM sleep is where our brain is actually awake and our body shuts down. We lose muscle tone during REM sleep, but our mind is awake, which is one of the reasons where during deep stages of sleep like REM is where we consolidate our memory. So I would almost
REM,
like
REM. What's it?
Rapid eye movement.
Okay.
So your friend, the person you just mentioned, if he would fall asleep, he would probably almost go immediately into REM sleep, which you could probably see through his eyelids, his eyeballs moving.
Okay.
Because our body is very smart.
Well, he wasn't a young man. I mean, he was probably 80-ish or 78.
But regardless of age, we do need REM sleep to function.
Interesting. Okay. Second break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacist can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Are you tired of paying hundreds of dollars to find out your A1C and cholesterol levels? You don't have to do that anymore. Every month in each of our pharmacies, you can get your A1C lipid profile, which includes your cholesterol levels as well as glucose results, while you wait. A Medicine Center pharmacist will draw your blood and give you the results in just minutes. You can also get your blood pressure checked for free. Call us to find out when we'll be in the Neighborhood Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia. 330-454-8772.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about sleep apnea and more.
Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
When we hear the word pharmacy, we think prescriptions, right? Hi, Paul White for the Medicine Center Pharmacies in Stark and Tuscarawas counties, a locally owned Health Mart pharmacy. Of course we carry prescriptions, but our stores carry way more than that. We have a large selection of ostomy and diabetic supplies and compression socks. All of our pharmacies carry a variety of canes, walkers, bath seats, rollators, and commodes, all at super low prices. Our rollators are only $69.95. Call or stop by our local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you. Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. A locally owned Health Mart pharmacy, whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you. Welcome back to Health Matters at the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Today we're discussing the importance of sleep and how it impacts the body with Joel Porquez, clinical manager of Mercy Sleep Disorders Center. You know, you can pick this program up on our podcast if you haven't been able to catch the whole program. Very interesting discussion that we're having on sleep disorders today. So we'll get back to the show now.
We had a question from Sue in Canton, and she wants to know if sleep apnea affects kids too.
It sure does. The thing about kids is how they act differently when they're sleep deprived, possibly due to sleep apnea. A lot of it is we're in the epidemic of childhood obesity. So if a child does have sleep apnea, they are hyperactive. They are wide open. It is not uncommon for them to be misdiagnosed with ADHD, attention hyperactivity deficit disorder. In the society that we are, if a physician doesn't have the time to dig in a little bit further, then it's quicker to put them on a medication than it is to get to the root of the problem. And so yes, and the question, the fascinating part that I thought when I learned this is that for a kid to act the way they do, hyperactivity, behavioral problems due to sleep apnea and that's causing them to be sleep deprived, it's only mildly sleep deprived. It's not something severe that my kid's not sleeping for the past week. Just something very mild. If they're not getting, depending on their age, that 9, 10, 12 hours a night, then you might want to question or start observing. Because you can go to the grocery store and you say, look, my kid's not tired. They're running around in circles. Well, they're doing that to stay awake.
They're knocking over displays.
Yeah. But what happens when you pick them up or put them in the grocery cart? They're knocked out as soon as they can sit still. So I think behavior, yes, it's worth getting. Again, the American Academy of Pediatrics came out, I think it was about 5-6 years ago, that any child with restless sleep and snoring should be evaluated.
All right. So you mentioned there's some clear-cut examples if you witness some things for your kids. You mentioned some things for adults. What about for people listening that are on the fence right now thinking, should I go talk to my doctor about getting an evaluation? Can you give any tips on that?
Sure. And I think in my experience, it's more of the wife or the partner that wants to urge, you really need this, get this done, and it's usually
because it's disrupting his or her sleep.
Exactly.
Okay.
Because that's why they say good sleep health does affect the whole family. So I think, the wife, for example, might be sleep deprived herself and urging the husband, but then he says, no way am I going to go in there. I'm not going to sleep well. But I think we want to really consider the quality of life that we want to have, especially, what's important to us. Do we have children we want to be around for? Obviously, that's just my opinion, but we really have to answer, do you want to live a sleepy life? Because it's already proven that Americans are sleep deprived. So we can ask ourselves, how long will this go? I would say, do I have any cardiac family history or kidney history or diabetes? Because with sleep apnea, obviously that could make it worse.
All right, why don't we talk about creating a positive environment for restful sleep?
Good question. So I've always said sleep is a process. How many of us can sleep, it's 8 o'clock at night, and fall asleep like that? I mean, it's very difficult, right? So we have to make sure that our sleep environment is conducive. It's dark. Especially if you're a shift worker, you're going to come home during the day, the sun is still up. We want to make sure everything is blacked out. We actually need cooperation from the delivery guy, if you work nights, to your pets, because your pets will wake you up, if you can get cooperation from them. But usually we have to make sure.
Do that? Hey, dog, quit this.
I've been blessed with a dog that loves to sleep, so my Italian Greyhound loves it.
Go to sleep, Fido. Yeah.
But if you're not, you make sure you have a nice, comfortable bed. That's your bed is nice and cool. Depending on what you read, some people will say that the sleep onset occurs at a very low body temperature, around 62, 63 degrees. So that's why if it's cooler at night, people tend to sleep better. That's why you get the covers and you snuggle and do all that stuff. So I think the main thing for the environment, make sure that it's a process, thinking that I'm going to dim the lights. If my bedtime is at 10, I'm going to start dimming the lights at night, say 8:39. I'll even start talking in a softer voice. We're not going to watch exciting shows on TV, and therefore, when it's time to sleep, it's cold, the lights are dim, our bed is comfy, everybody's tucked away, and we transition to sleep. That's the process part that I'm trying to get at.
And of course, as a pharmacist, I'd say don't have caffeinated beverages after 6 p.m. and be mindful of those stimulants and things that can kind of sabotage.
That's a good point. So caffeine and strenuous exercise before bedtime, although might have been recommended years ago, it actually can help wake you up and keep you awake.
Tell us about your school start time comments, because I've thought those were really interesting.
Well, this is my fascination in sleep has led me to this to help advocate a little bit, and it's a movement that's been started by health professionals, teachers, concerned citizens, educators, and I got into it because it's evidence-based. And what it is trying to get more states to consider moving their school start times, especially for adolescents, to 8:30, or at least past 8 o'clock. 8 o'clock, 8:30. American Academy of Pediatrics, American Academy of Sleep Medicine have all mentioned around 8:30, for the mere fact that adolescents, kids are going through puberty, and physiologically, when kids are going through puberty, their bodies are changing, and with that change, it actually resets the area of their brain that controls their sleep. So this is where teenagers get a bad rap of lazy teenagers. They go to bed late and wake up late. Well, there's something to be said about that, because there's something called delayed sleep phase, where they go to bed late and they wake up late. So the movement is to try to get to bring awareness to schools, because most school start times are dictated upon bus routes. What time is the bus going to come pick up their kid? So if we think about it, a teenager that's supposed to be sleeping 9 hours a night, and they are bombarded with homework, and they go to bed at 11, and they have to catch the bus at 6. Mm-hmm. They're basically only getting, if they can go to bed in a snap of a finger, right, at 11, which it may take 30, 40 minutes for them to wind down, which is why I say the whole sleep process, then they're only getting 6 at best, 6.5 hours a night.
Well, it seems to me there's a lot of obstacles to this later schooling, like sports after school, and jobs after school, and and all that other kind of stuff. I would think sports is probably the biggest.
That's a whole great other radio show right there, because sports has been linked to performance in sports. If the athlete or sleeps long, has good quality of sleep, they actually do better. Mm-hmm. There even been studies how even the Cleveland Indians have a sleep rule.
Do they?
Yeah.
Interesting.
Basketball players. Who's that guy with the Golden State who'd always foul everybody? The kind of bad rap for bad attitude. They realized that he would foul out more the less hours of sleep he would get.
Oh my gosh!
Oh, holy cow!
and there's even research out there how the difference in the Olympics of making the podium, of making the bronze to a gold, 1,000th of a second is linked to how much time they slept the night before.
I'm not picking on you, sports folks. It's okay. So don't call me up and say you're picking on
I got
sports.
But the movement is really good to just increase awareness that can we align the school starts with the physiologic behavior of the adolescent, and then they have been shown to do better in school, and so forth. So
guess what? We're out of here. We only got halfway through the schedule. This is nuts. Okay. Thank you to our guest, very special guest, Joel Porquez, clinical manager of Mercy Sleep Disorder Center. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Mercy Medical Center, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. We are a local Health Mart pharmacy, caring for you and about you. Have a healthy week, and we'll see you again right here on 1480 WHBC.
The preceding program was sponsored by the Medicine Center Pharmacies.